Hi, my name is Monica, and I'll be your nurse today. And what's your name?
Desmond.
Nice to meet you, Desmond. And how old are you?
25.
25. Well, today you're in for just a cardiac and peripheral vascular assessment. I'm going to be doing a lot of listening and a lot of touching. Doesn't mean that anything's wrong. I just want to make sure I do a thorough assessment. Do you have any questions before I get started?
No.
All right, I'm going to wash my hands. First, I'm going to start at your upper extremities. I'm looking at your hair distribution to make sure that it's even. I'm looking at your arms to make sure they are symmetrical, which they are. Your skin is also warm and dry to touch. Your capillary refill is less than 3 seconds. Your skin turgor is elastic and bounces back appropriately for your age. Can I get you to grip my fingers? And your grip is strong and equal. All right, now I'm gonna palpate your pulses and just get you to do your arms this way. This is your radial pulse, and this is your brachial pulse. All right, now that we're finished with your upper extremities, I'm gonna be inspecting your neck. I'm looking to see if there are any lumps, bumps, or bruises and pulsations, which they're not. I'm also going to inspect your carotid arteries, which is where your neck is. I'm just going to palpate. And on this side, all right. Now, I'm going to listen, and I'm going to make sure I'm doing it one at a time. I'm going to do it with the bell side, which is the small side. What I'm going to have you do is take a deep breath, exhale, and then hold it. And I'm going to listen to the 3 sides. All right, you can breathe. And again, inhale, exhale, and then hold it. All right. Now what I'm going to do is I'm going to move on to your heart. I'm going to listen, and I'm going to do some patient education so that way you know where each marking is. I'm going to start with the diaphragm. I'm going to start from your second intercostal space on your right sternal border. This is your aortic area. I'm going to move over across to your second intercostal space. To your left sternal border, this is your pulmonic area. Then I'm going to go to your third intercostal space, which is your left sternal border. This is your Erb's point. Then I'm going to go down to your fourth intercostal space, which is your tricuspid area. Then I'm going to go to your fifth intercostal space. This is your mitral area. Now I'm going to listen to the bell with the small side. This is going through your second. This is your aortic, your pulmonic, your Erb's point, your tricuspid area, and your mitral valve. All right. Now we're done with that. I'm gonna have you lay down. And I'm gonna assess your heart. Now first I'm gonna do your jugular vein distension. I'm gonna have you look to the wall. I don't
Turn?
see. Yes, turn. No, just your head.
Okay.
Sorry. I'm gonna have you look to the wall. No distension here. And I'm gonna have you look towards me. And no jugular vein distension here. All right. Now I'm gonna be inspecting your precordium, which is the area around your heart. I'm looking for any lumps, bumps, bruises, or pulsations, which I don't see any. All right. Now I'm gonna listen to them. I'm gonna start with the diagram, which is the big part. diaphragm. This is your aortic, your pulmonic, your Erb's point, your tricuspid valve, and your mitral valve. I'm also going to palpate them. This is your aortic area, your pulmonic area, your Erb's point, your tricuspid area, and your mitral area, which is also where your apical pulse is. All right, now I'm going to go back to the bell. Your aortic, your pulmonic, your Erb's point, your tricuspid, and your mitral. Can I get you just to roll over to your left side? All right, this is your left lateral at the mid-clavicular line. And this is also your mitral valve. All right, let's get you to relax for me. You can continue to lay down and you can lay on your back. Now I'm gonna be checking your lower extremities. I'm looking at your legs, they're both symmetrical. Your hair distribution is even. Your skin is warm and dry to touch. I'm not palpating any edema. And I'm not noticing any varicose veins. Now I'm gonna palpate your pulses. Your groin is your femoral pulse. Behind your knee is your popliteal pulse. Inside your ankles is your posterior tibial. And on the top of your foot is your dorsalis pedis. All right, this concludes your assessment. I'll help you sit up. Do you have any questions for me?
No, ma'am.
All right. Today I'm giving a report on a 25-year-old male who came in for just a cardiac and peripheral vascular assessment. We started at his upper extremities. His bilateral arms were symmetrical. His hair was evenly distributed. His skin was warm and dry to touch. His turgor was elastic and bounced back appropriately for his age, and his capillary refill was less than 3 seconds. His grip was strong and equal. We then palpated his radial and brachial pulses. We then moved on to inspect his neck. No lumps, bumps, bruises, or pulsations noted. We palpated his carotid arteries one at a time. We then listened with the bell. No murmurs or thrills noted. We then listened to his heart with the diaphragm and the bell, both sitting and lying. S1 and S2 noted. No murmurs or thrills noted. We then assessed for a jugular vein distension. No distension noted. We then inspected his precardium. No lumps, bumps, bruises, or pulsations noted. We palpated all areas of the heart. No tenderness noted. We then looked at the fifth intercostal space, the mid-clavicular line, where the apical pulse was noted. We then had him turn left lateral, fifth intercostal space, mid-clavicular line for the mitral valve. We then assessed his respiratory rate, which was 84 and was noted to be a regular rate. We then moved on to his lower extremities. His hair was evenly distributed. No edema noted. No varicose veins noted. His skin was warm and dry to touch. We then palpated his femoral pulse, his popliteal pulse, his posterior
tibial post and his dorsalis pedis, and they were all palpated and equal bilaterally.